It's a great delight to again fill in on the excellent work that on behalf of all dear colleagues I presented at the SO4 abstract, the progression-free survival in patients with cholangiocarcinoma with FGFR2 fusions or rearrangements, the FIGHT-202 study, post-hoc analysis of prior systemic therapy response. As you heard us, the FIGHT-202 study, as you all know, had 3 cohorts, the patients with the fusion rearrangements in cohort A, patients with the other genetic alteration in cohort B, and the patient without FGFR alterations in cohort C. The focus that we had today in the presentation was more about cohort A, and if anything, we have seen that in follow-up to the patients with the different lines of therapy, the important component is that the PFS remains robustly there, and if anything, after the second line, PFS was also improved to 4.4 months, and this is with systemic therapy. And the patient who received Pemigatinib, however, it was 7 months. On the other hand, for the patient who received third line, the PFS with systemic therapy was close to 6.6 months, while with the Pemigatinib, again, which is rather positive and surprising, 8.9 months, which remains there. So if anything, we were honored to really, of course, acknowledge the limitation of the study because of the retrospective nature, but this post-hoc analysis will prove again one more time that patients who really get the Pemigatinib in case of FGFR alteration, and if you follow them in second and third line when they get the Pemigatinib, there is a critical improvement in regard to their PFS, which of course will hopefully translate that in the OS as with the FIGHT-302 study, which is looking into the Pemigatinib versus gemcitabine cisplatin in first line treatment.